You've seen her on ABC, NBC, CBS, and Fox across the country. I recently saw her speak at NASDAQ, which is why I brought her here to speak to you today. She is on a mission to improve healthcare, fighting battles for patients, and winning Healthcare 911, America's epidemic. Gail Trauco.
It's January 1975, and I'm sitting at the kitchen table in my grandparents' farmhouse in Foggy Bottom, North Carolina, of all places, studying for a chemistry test. My grandfather comes stumbling into the kitchen at supper time, holding his chest, and says, "I need for somebody to take me to Dr. Corbin's office." Well, for my grandfather to ask to go to a doctor, I knew he was sick. I turned to my 16-year-old sister and said, "Can you drive Papa to Dr. Corbin's office? I need to finish studying for this chemistry test." So off my younger two sisters go with my grandfather in this clunkety old truck. An hour later, the neighbors are knocking at the door. Their son was there to tell us my grandfather died in the general practitioner's office. He was never taken across the street to the emergency room at the local hospital. He didn't have health insurance. 1990, I'm working in the surgery clinic at Duke University. I get a call from my youngest sister. "Big Mama died in the ER. I said, "What do you mean she died in the ER?" Well, I couldn't call an ambulance to transport her to the hospital. I had to drive her myself. She didn't have health insurance, you know. Oh, I well knew. And I knew that those were keys for me, that I had to transform my life and go on. Well, I was poor white trash family. I know what that is. I grew up in rural North Carolina. I owned one dress and one pair of shoes that I wore to church every Sunday. For me, that was normal. I didn't know any different. So I was awarded a scholarship at the University of North Carolina at Chapel Hill, the Harvard of the South, because I had book sense and I had straight A's all the way through school. Well, my first media interview, these people said, "We know you're real because you wore the same dress and same pair of shoes to every interview." I didn't know there was anything wrong with that. It was all I had. So that same dress and same pair of shoes landed me a nursing job making $5 an hour in 1975 at Duke University. I had to look around and think, I can't just do bedside care because I couldn't make any changes. By 1996, I started my own business with a desk in the corner of my bedroom and one contract at $35 an hour as a contract nurse. I thought that was pretty good money. Well, it wasn't long before I found myself solving problems for patients. Today, I'm a patient advocate and own one of the largest turnkey advocacy practices in the United States. I help patients with their medical, legal, and financial journey during an illness. Millions of Americans today suffering a critical illness face roadblocks in our current healthcare system to the best healthcare and healing modalities out there. It leaves these patients and their families feeling grief, hope, and despair. Well, that has to change. I have to tell you about some of the families that I have the opportunity to work with. A 6-year-old whose mother died with ovarian cancer 6 months ago left a suicide note that she had to cross over to the other side to be with her mom. She walked out in front of a train. A 6-year-old was mentally capable of figuring out how she could commit suicide. A 12-year-old who tells his current family and his therapist, "World's better off without me." His father committed suicide when he was 4. Another family I worked with, the wife has attempted suicide 4 times in the last 12 months. Her husband had cancer, and his health insurance company kept denying chemotherapy refills until it was too late and he died. Well, every 6 days, I have to pick up the phone and call this same insurance company to get a behavioral health care admission approved for this patient so the therapist and the doctors can get her medication regulated and get her out of this deep, dark depression she's in. I have a 94-year-old veteran who was misdiagnosed at an ER at a VA hospital in Shreveport, Louisiana. He had hypoxia. Very simple thing to diagnose if you put a pulse ox on a patient's finger. Well, today, 6 months later, he has dementia from oxygen deprivation. And one of the largest cases that will be heard in the Senate and for Congress I'm leading right now is for our veterans that served in Vietnam that are being diagnosed with leukemia, polycythemia vera, and MDS. I can't just go out and run an ad in the newspaper, but this is on its way to become one of the nation's largest top class action lawsuits for the U.S. Army. I don't mind talking about it because the Georgia Senate just heard it, and it will be on the docket to address with Congress in the next 90 days. I'm making changes. I've gone from a $5 an hour nurse to actually, I have a full-scale office in Barnesville, Georgia, and one in Peachtree City, Georgia. I only hire part-time college students, and I pay them a great salary. They do an awesome job. And the greatest thing for me is that when I go to bed every night, I have made a difference as a nurse for somebody around the United States. And when Big Pharma starts calling you with patients that are calling them to resolve issues, you know that I'm doing something right. So for each of you, I'm your patient advocate when you have a healthcare 911. I'm Gail Trauco. Thank you for having me here.